But first, let's talk to our initial guest, who is Sir Ian Diamond, the head of the Office of National Statistics. A very important week, of course, to talk to him after those questions asked about the way that coronavirus statistics are calculated. Thank you very much for being with us this morning.
My pleasure.
I just want to start with the survey that you have been carrying out recently, trying to get a bit of a grip on the number of people who currently have COVID-19 and, crucially, the number of people who have antibodies to it as well. What is it currently showing?
Sure. So what we've been doing is testing in a sample of households right across England and testing everybody within those households. And what we're showing is that across England, between 0.03 and 0.06% of the population have the virus at any time. And to put that into other numbers, that's about 1 in every 2,300 people have got the virus, about 1,700 new cases a day. And then we go further, and from a sample of that sample, we take blood samples so that we can look at antibodies in the population. That's people who've been exposed to the virus, and we find there that around about 6.3% of the population have been exposed to the virus, and that's around about 3 million people in the population.
So still, obviously, a very long way away from herd immunity. The government's been gradually easing lockdown now over a number of months. Have you started to notice any uptick in the number of people testing positive for the virus?
No, we haven't. We're basically flat over the last few weeks, and clearly there are one or two outbreaks in various parts of the country, and over the next few weeks we will be scaling up our survey so that we have, if you like, better traction on estimates right across the country, making regional estimates in particular, but also being able then to have in reserve the opportunity to send extra sample into areas where we start to see the beginnings of an outbreak.
It's very interesting to hear about the focus on regional testing, regional sampling. Do you think we need to scale up testing across the United Kingdom, really to get a bit more of a grip about where these outbreaks are then?
Well, I think under the leadership of Baroness Harding, there's been a big move, and certainly we have been helping the Joint Biosecurity Centre to get really fast data, not just from testing, but also, for example, from measuring the extent of the virus in wastewater, to get early sights of any particular outbreak. And then you're absolutely right. There has to be very large testing in those areas with tracing to be able to keep the epidemic under control. And certainly I think that's where that, if you like, rise in the ability of us to test and the number of tests is incredibly important.
Yeah, really important, particularly, of course, as the lockdown does continue to be eased. You were saying a little earlier that things have been quite flat on the number of infections. Would you have expected to see an increase in the number of infections as lockdown was eased, if it was going to, if you like, lead to it?
I think it's a really good question, Sophie, if I may. And of course, the answer really does depend on how the population works, because the message has been quite consistent, and that is we must be alert and we must socially distance. And if we are really super careful, and if we are able to follow all the rules, and it does seem to me that we should expect there to be a relative flat line at the moment. Clearly, over the autumn, we will need to be ever vigilant.
Yeah, certainly a really important thing to go for going forward. I just want to talk to you a little bit now about the numbers and the data, because it's obviously, we're told by the government that the government is using data to drive the response to coronavirus, to influence policy. And yet there's been a lot of questions this week about whether the data can be trusted. The Health Secretary, Matt Hancock, are ordering this urgent review into the way Public Health England counts coronavirus deaths in England specifically, saying that if someone was previously diagnosed with COVID-19 but subsequently died of unrelated causes, they would still be classed as a coronavirus death in that England daily tally. I mean, this feels quite astonishing to me. Are these figures fit for purpose?
Well, I think it's really, really important to recognise that different statistics are used for different things. And so the PHE data are basically aimed to look at, if you like, trends over time in recent times. If you want to know the accurate data on deaths, then of course I would say this, but my recommendation is that you go to the ONS data. Why should you go to the ONS data? Well, we believe very firmly, as does everyone, that the very best person to take a decision around what is the cause of death is the medical practitioner who is there at the time. And let's remember, sadly, this is a loss, every death a loss to family and to friends. And the medical practitioner takes that view. That's why we are part of a WHO referral group, which very early in the pandemic worked out how to, if you like, make COVID-19 a cause of death. And then we worked with our colleagues at National Records in Scotland to get how to define that into the advice that goes to medical practitioners. Therefore, our data, published weekly, has by the medical practitioner a decision on what was the cause of death. And I really enjoyed your article, by the way. I don't know if it was yesterday or the day before. But I would say that your point, someone who had COVID and then gets run over by a bus, I think it is, virtually, it's inconceivable that a medical practitioner looking at a road accident is going to say that was the cause was COVID-19. Therefore, my recommendation, go with the ONS data. We've worked very hard to make our data very quick and probably, well, it's certainly among the fastest recorded data by cause of death anywhere in the world.
I mean, you're right, of course, that the ONS is the gold standard of data and that different statistics are used in different ways. But you can't really blame us for focusing on the daily death data when that was the one that the government was talking about in its daily press conferences. It feels to me like you're saying we can't really trust it.
No, not at all. What I'm saying very clearly is that we can trust it to tell you whether there is a trend in the last few days or in the previous days. That's exactly what it was put together for, and that's exactly why it's there. That's why we acknowledge, for example, there are always reductions in those data at the weekend because there are no registrations on these. So it allows us to look at the recent trend. But if you're interested in the really accurate data, you don't have to wait long, let's be honest. Stick with the ONS data.
OK. The Mail on Sunday reports today that they think that the death toll in England, according to these PHE numbers, could have been overestimated by around 4,000 people. Do you think that's right?
Well, I'd need to look very carefully at those data. I mean, I still stick very much with our data, which are showing that around about 48,154 people at the moment have been reported as dying due to COVID, and those are the data that I would stick with.
OK. Now, it's not just the PHE data that there's been a question mark over it too. A Sky News investigation found that at the height of the pandemic, the government overstated the number of people who had been tested for coronavirus by 200,000. We were told 2 million people had been tested by mid-May. That was then revised down to 1.8 million. I mean, the statistics we have on coronavirus are dictating the policy. The data is so important when it comes to public confidence. How have we got in such a mess over numbers?
Well, because it's great to have data journalists such as Ed Conway working with you, Sophie, as I may say so. And look, I think early on in those testing statistics, we were putting something together new as a country, and I think there were some challenges, and I have to say ONS has worked hard with DHSC to get into a position where we can trust those data. And the letter last week from the Office for Statistics Regulation, that's the statistics regulator, complimenting the progress that had been made, I think is an important moment. OK. Now,
the UK was also quite slow to recommend the use of face masks, face coverings, to stop the transmission of the virus. I know you've been doing a bit of work on whether or not people are wearing them now. What is it that you've been finding?
Sure. Well, we have also had a weekly survey which has gone out to a representative sample of the population right across the country, and we analysed those data incredibly quickly. And what we're showing is that week on week there is an increase in the number of people who are using face covering. So last week, the data published just 4 or 5 days ago would show that 61% of the population had used face covering in the last week, and that's up from 50% the week before. In Scotland, 77% of the population using it for shopping, and that I think will continue to go up as it's become mandatory. In England, 40%, but of course, as that becomes mandatory next Saturday, we will see that increase as well. But certainly, people using face covering and becoming the norm in many parts of society.
Very interesting to see that kind of significant change in such a quick period of time. And just finally, I just want to talk about the economic hit of coronavirus, because there was hope that we would bounce back quite quickly once lockdown was over. But I have to say, if you look at the latest GDP data, it shows the economy only grew 1.8% in May. Now, that, of course, is much lower than the 5.5% expected. Is the idea of a V-shaped recovery for the birds?
Certainly not, but equally it's too early to tell. Certainly that 1.8%, which is 24.5% lower than February, was lower than many analysts were expecting and hoping for. And we will be looking over the next little while to see the extent to which it increases. Certainly, we did see some indication, with manufacturing up 8%, construction up 8%, of a return, but clearly there is much to do in places like hospitality and in accommodation. I would say again that our data are showing that week on week people are saying they are more likely to go to a restaurant, for example, and so we will, I think, see the economy pick up. But how fast it will pick up with that V-shaped recovery that you referred to, Sophie, it's too early to tell.
Really interesting to talk. Sir Ian Diamond, thank you very much for being on the programme this morning. Thank you.
It's been my pleasure. Thank you.